Hi, I'm Jenny Delfs, Dr. Jenny Delfs, and this is Lisa Zallar, a nurse practitioner, and we're both providers at Sawtooth Mountain Clinic. We're recording this today to talk about a new offering for healthcare that Sawtooth Mountain Clinic has, which is telemedicine visits. And we're going to be able to see and help do provider visits with video conferencing or on phone, and we're here to introduce you to that new option for care. We want, in this really unprecedented and uncertain time, to continue to do the important job of helping you, our patients, manage your chronic conditions and help you through some acute concerns and illness. We really want to be there for you. So seeing patients via video conferencing or talking to them on the phone can, one, help us encourage the vital social distancing that we're all practicing, two, keep our most vulnerable patients out of the clinic, and three, prevent clinic transmission of COVID-19. Obviously, we can't do all visits this way, but for those that we can, that are vital to get done, this is a really good tool that we can use. Lisa has been working like heck this last week setting this up here. This is something that usually would take months, and really Lisa and the whole team here at Sawtooth Mountain Clinic have been working like crazy to get this set up here. And thanks, Lisa, for all that work.
Yes. We'd like to do a lot of video conferencing, and in order to do that, we're going to need patients set up on the patient portal. So if you have a portal account already, you are a step ahead. If you don't have a portal account set up yet, that would be the first step, is getting signed up for patient portal. And once we have that in place, we need to do some consent forms. You need to consent to telehealth because it is a little bit different service than regular office visits. But once we have your portal set up, you have consented to telehealth, then we are all set up for video conferencing visits. If you are hoping to do phone visits, really we're pretty much set up right from the get-go for that.
And to sign up for portal, calling the clinic and the clinic staff can help get you walk you through that.
Exactly. You need to be assigned a PIN number from us, which would require a call to us, but I think all of the rest of the steps can be done easily remotely. So.
Okay.
So what you will see is a portal message coming from the front desk that will have your meeting time listed. And it will be as simple as you opening that portal message and clicking on a link. And you've got a 20 minutes, right now we've scheduled them for 20 minutes. We're still sorting out which time frames are going to be most appropriate for which visits. Right now we have a 20-minute time slot to video chat. We will be working in our regular EMR, so we can do prescriptions. We could do orders for tests if needed. At the end of that visit, we will sort of come up with our summary and what our plan is, and then visit ends and we go on with our day.
Yeah. So we're using an app called Zoom, and so if you are visiting with us via a smartphone, downloading that app is the way it works best without delay.
Correct. Yeah. So what we found, what patients have found so far, we've been using this for only about three days here at the clinic, is that if you're going to be on a smartphone, downloading the app to your smartphone just allows a little smoother transmission of voice and data and voice and video. So it seems like it works better on the app. I think it will work either way, but I think it works better if you have that app downloaded. Zoom is something that we can use across all devices, so we can use mobile devices, you can use your home PC or laptop, as long as you have a camera enabled.
Yeah. And so physically, we kind of set my phone up and your Surface up to show physically what this might look like. So where is the provider and where's the patient in this?
Yeah, so
these visits?
I'm assuming patients are at home mostly.
Yeah. You should be at home.
You should be at home mostly. But they could be any number of places. There's certainly essential personnel that may still be at work. One thing that we want to make sure is that you don't forfeit or waive your right to confidentiality simply based on a Zoom or video conferencing visit. So we do want you to have a private space in case we need to say things that are sensitive in nature. And so making sure we have a private space set up, but it could be mostly at home. It may be at work. Providers, we will be a mix of in the office, so you will see us, you'll see, maybe the inside of our offices. There are some of us who will be working from home at some point too here, and so you may see us at home. But that should be the majority of the combinations.
So if I'm the patient on my phone, I can see Lisa on my screen. There she is.
Hi.
And she can see me.
Yeah.
With some delay.
Yeah.
On her screen, and we can have a conversation.
Mm-hmm. Yeah, and so I think if we, there are things like we might be able to see rashes, or there's certain physical exam components we may be able to complete this way, but mainly this is going to be mostly a chat and, trying to figure out the best care for the patient over video conferencing. There may be a situation where we say we can't deal with this issue using video or phone, and that we need to do an office visit, and that would be something that we could decide as we're doing that.
And video offers quite a bit of advantages to just talking on the phone.
Absolutely, yeah.
So if this is something you're interested in, and I should also mention our behavioral health staff are seeing patients this way and available for mental health needs. And thank you for listening to this today. We just want to remind you to keep your hands clean and off your face. Stay home as much as you can. Keep connected to your loved ones. Reach out to people that might be isolated. And call the clinic if you're sick. And we're all in this together. Thanks.